Track 2. Continuation of Chapter 2. FGM in Iran. This comprehensive research shows that FGM is prevalent to the rural areas of parts of 3 western and 1 southern provinces of Iran: West Azerbaijan, Kurdish populated south, Kurdistan, Kermanshah and Hormozgan provinces, and close by islands. The provinces of Kurdistan are populated by Sunni Shafi's majority and certain Shia communities. The remaining provinces have mixed Sunni, Shia, and other ethnic and religious populations, such as large minorities of Shia Turkish Azeri and small minorities of Turkish Ahl Haq. Western Azerbaijan, between the towns of Mahabad and Mianduab, plus a small community of Armenian Christians in Urumia and Shia Kurdish Kalhor, as well as Ahl Haq Kurds in parts of Kermanshah, which do not practice FGM. However, some Shia women who live near Sunni populated areas in Hormozgan province do currently practice FGM, and historically, many groups of Shia Kurdish women in parts of Kermanshah and Ilam province have practiced FGM. It is important to stress that FGM is mainly associated with Sunni Kurds of Shia sect who speak the Sorani dialect, and not those in the Kurdish Kermanji speaking areas of Iran, Iraq, Turkey, and Syrian Kurdistan, even though they are also Shia Muslims. Likewise, the Ahl Haq Kurds, Alevi, Yazidis, or Kurdish minority of Armenia, as well as the forcibly migrated Kurds of the east and north of Iran, practice FGM. In Chapter 3 of this book, an argument will be made for the legitimacy of the claim that FGM is not totally an Islamic belief, or more specifically, that it should not be associated with Shafi sect. FGM is not found amongst the Kurdish Kermanji-speaking inhabited areas, nor in the large areas within mainland Iranian Kurdistan, where there has been no evidence of FGM for the last 3 generations. As mentioned previously, it is important to highlight that the practice of FGM in Iranian Kurdistan is patchy and demonstrates sharp variations from one generation to another, even from one village to another. With respect to the southern part of Iran, it is unclear how the practice of FGM came to this region. One argument is that the custom was brought into the country through the naval exchange between India and Somalia, Muhajir, 2010, and to this date, some small communities of Afro-Iranian live in Kesh. In addition to southern parts of the country, FGM is also practiced in some villages and rural parts of western Iran, as well as in Kurdistan and Kermanshah province, and in West Azerbaijan province. In some locations, girls are usually circumcised between the ages of 3 to 6 with sharp razor or a knife, and afterwards, some ash or cold water is applied to their mutilated genitals. Though this is changing, increasingly, more hygienic material as betadine and bandage pads are used. Some locals in these parts, including Hormozgan province, believe that FGM is a tradition from Prophet Muhammad and that circumcised women who have undergone it are purified. According to this group of believers, FGM helps keep girls chaste by decreasing their sexual desire and preserving their virginity before marriage, and produces faithful wives. Another local custom practiced in limited areas in Cheheltik, 40 razors, which are believed to take away girls' sexual urges and make them smell more pleasant, and therefore more sexually appealing to men. In the south and west of Iran, some bibis make a small razor cut to the thigh of the girl for those parents who cannot bear to see their children suffering. This practice is called Tighe Muhammadi, Muhajir, 2010. In various villages in Kermanshah and Kurdistan provinces, some women believe that girls should be circumcised, or at least cut. With a small amount of bleeding, dirty blood exits the child for both religious and health reasons. The local term for this practice is pajala. Some citizens of Bandar Kang believe that women are evil creatures who can only be saved from the reach of the devil by being circumcised. Jalili, 2007. Bandar Kang is located 5 kilometers from Bandar Lenge in the south of Iran. In Bandar Kang, girls are circumcised with a shaving razor when they are 40 days old or older. According to the study of Parisar Razazada Jalili, 70% of the girls in this port city have been circumcised. Most groups which practice FGM in Iran use religious to justify the practice. They usually believe that FGM was practiced during the early years of Islamic kingdom, where the prophets and imams' wives and daughters were circumcised. Others mainly argue it is a religious duty and local tradition, and because their mothers and grandmothers did it, they will continue the tradition but are unaware of FGM's medical consequences and health hazards. Jalili, 2007. FGM remains a taboo issue in Iran even after it was included on the FGM practicing list. Alavi and Schwartz, 2015. Government ministries either deny it exists or conceal its existence to the general population. A report from the head of the Scientific Association of Social Workers of Iran stated that FGM is more of an African issue and is not a serious problem in Iran. The report claimed that FGM in Iran only happens in a few villages with populations of fewer than 2,000 people. Research background. These inquiries started in 2005 when, for the first time after many years, the author of this study returned back to his birthplace, Iranian Kurdistan, from Europe, to find out more about FGM. Prior to his return, he had been working in Africa for a number of humanitarian relief NGOs, where he observed various efforts and projects to combat FGM administered by the United Nations and UNICEF in countries like Somalia, Kenya, and Sudan. Remembering vaguely from his childhood memories that FGM also existed in some parts of Iranian Kurdistan, upon his return, he decided to conduct some preliminary research, starting with his very own family and close relatives, and he discovered shocking evidence to indicate that FGM has long existed in areas of Mukrian and even in his own family, where his grandmother's mother and sister were circumcised. Gradually, a field study began, and at the same time as going through neighboring regions and collecting data, a film was made out of the interviews and related footage. The first and only publicly available documentary in the name of tradition about FGM in Iran was filmed by the author whilst doing field work in Kurdish villages and neighborhoods of Mahabad, some villages of the nearby Kurdistan province, in regions of Hormozgan, located between Kurdistan and Kermanshah province. Ahmady, 2006. This anthropological documentary, now re-edited and publicly accessible alongside this study, contains recorded footage and interviews from the regions and villages of Kermanshah and Hormozgan province, and from its islands, for example, Qish, Hormozgan, and Kish, as well as interviewing local women and women circumcisers, bibis, professional cutters. The documentary records the opinions of local men, medical staff, doctors, and clerics. On the page 42, there's a picture. It is called Fieldwork, Mahabad Bokan. It is taken by Kameel Ahmady. Based on the findings of the film, it was clear there was a need for further research to examine FGM systematically in Iran, especially in the geographical pockets where there is a high prevalence. A scientific country-wide research project was therefore started. Local resources were required to carry out such a comprehensive study. Training was provided for a number of young, enthusiastic male and female students and individuals who were willing to practice and conduct most of the face-to-face field interviews. Later, this research, various interest individuals also collaborated, and UNICEF-style standardized questionnaires were used to collect data. Strong communication and networking with the local populations enabled us to win their support, as well as that some of the community and religious leaders and a number of academics from civil society, both inside and outside Iran. There's a picture on the page 43 of the village of Hormozgan, Marivan, Kurdistan. Picture is taken by Kameel Ahmady. It was decided that the research would be conducted in the rural parts of Iran, rather than the urban and cosmopolitan areas. Because of the lack of appropriate resources, funding, and legal authorizations. Also, evidence from the preliminary research and documentary indicated that FGM is less likely to occur in towns, other than in some outskirt areas and poor neighborhoods. Initially, villages were picked randomly from the predefined geographical positions in the north, west, east, and south. However, as our research progressed, more comprehensive village-by-village training and pilot projects were implemented. As the fact-finding mission progressed and more areas from each province were visited and samples taken, we were led to neighboring villages and regions and finally to the south of Iran and province of Hormozgan, where the rate of FGM is the highest in Iran. On the page 44, there is a picture. It is called Fieldwork in Other Provinces by Kameel Ahmady. It's a picture of a road leading to Elam, Mehran, and the border terminal. To assess whether other regions of Iran were affected by FGM, throughout our fact-finding mission and fieldwork, we continued to identify evidence of FGM in other provinces such as Elam, Lorestan, Charmahal and Bakhtiari, Kokiluyam Boyar Ahmad, Khuzestan, Bushehr, Sistan and Baluchistan, Golestan, Khorasan Shomali, Junubi, and Razavi, Gilan, and in the more central parts of Iran, such as Fars and Yazd. Despite the fact that some Sunni Muslims live in several of the above-named provinces, the study revealed no evidence in these locations of FGM. This study also confirms that there is no presence of FGM in the following: Sistan and Baluchistan, which has a significant population of Sunni Muslims of Hanafi sect. Hanafi is the fiqh with the largest number of Sunni Muslim, or among the forcibly migrated Kurds of Khorasan and Turkmen, of Hanafi Muslims of Golestan province, or the small populations of Turkish Sunni Shafi groups in Ardabil province and West Azerbaijan province. On the page 45, there is a picture. Data collecting west of Iran of a rural area consisting of a few females in the picture, a man, and a bunch of livestock. Interestingly, the Sunni populated areas of Lorestan region located in Fars province, bordering with Hormozgan province, are also FGM-free. Further, whilst there are some large Sunni areas of Hormozgan province itself, such as Bastak and its many villages which do practice FGM, this is at a much lower rate than in the same province in more the southern regions and islands. In the provinces of Khuzestan and Bushehr, FGM was not found among both Sunni Arabs and Shia Lur, though there was some evidence of FGM among old women in southern areas of Khuzestan province. FGM was also not found in the provinces of Lorestan, Charmahal and Bakhtiari, Shia Kurds of Elam, and only in very small numbers in the villages near Mehran, which neighbors Kermanshah province. There was a low incidence of FGM found among some women above the age of 50. The study also found that no young girls are now being circumcised, which indicates that the tradition of FGM has died away in most of the Shia communities of both Elam and Kermanshah. Maps, local guides, clerics, and personal connections in the area and with the people informed our research throughout the study. The research was conducted over the years by a small but very enthusiastic group. In some cases, bad road or weather conditions made it necessary to deviate from the scheduled routes and visit alternate locations. Since the study was not a full-time project and was conducted during different seasons, the initial fact-finding mission, fieldwork, and training took place in the span of 10 years, from 2005 to 2015. The study employed multiple approaches such as different phases, strategies, methods, approaches, and tailor-made training manuals to fit the various tastes and language of each region. A number of pilot programs were applied in different regions. To the west and east, where face-to-face visits with community stakeholders took place. Awareness-raising sessions, using different approaches and mainly with young women, were arranged to highlight the danger of FGM on women's body in human life. The sensation of men was also a part of the approach. The team engaged with groups of men in mosques, houses, and many public places to measure its level of success. Different sessions of lobbying were held with community leaders, and most importantly, with clerics and local women, as well as local and regional sheikhs, to gain their supports on banning FGM and issuing local fatwas. After each piece of fieldwork and face-to-face training lobbying, we carried out follow-up visits to the same villages twice, and 1 year later to assess the success and impact of the pilot programs. Research methodology. International data on FGM has been collected throughout a separate module of the Demographic and Health Surveys (DHS) program since the beginning of 1990. The module has yielded a rich data set comparable over the many countries, mainly in Africa, since the prevalence of FGM in Iran has not been addressed by UN, UNICEF, or any other international organization. In this study, we decided to conduct the first ever country-wide data collection project using a module similar to that of the DHS. The methodological approach adopted by the study was primarily participatory due to the subject matter. This methodological framework took into account the views of women and girls, in particular those of actual victims, so that our findings would reflect their true views. The language of the interviews was simple and user-friendly to avoid any ambiguity or misunderstandings between researchers and participants. Since the research stretched over a period of 10 years, the methodology was adjusted along the way as we came up with new strategies. UNICEF-style standardized questionnaires were used to collect data in the style of DHSA UNICEF's Multiple Indicator Cluster Surveys, MICS. Importantly, good communication and networking allowed the researchers to win support from the local population, some community and religious leaders, and a number of academics. Local individuals were chosen for the work, the aim being to ensure they adhered to ethical standards and maintained confidentiality. As May 1997 puts it, ethical standards in research are binding, hence need to be adhered to irrespective of the circumstances surrounding the research. They remind us of our responsibilities to people being researched. 2011-54. She adds that it is easier for participants also if they can take part with peace of mind, having all the relevant information about the research. May 2011. Participants were asked for their consent and were informed prior to the commencement of the research about how the data will be utilized and what its findings aim to achieve. In some case, interviews were conducted over the phone rather than in person, applying the same standards. A total of 4,000 interviews were carried out within the provinces of Hormozgan, West Azerbaijan, Kermanshah, and Kurdistan. In each province, 1,000 interviews were conducted, involving 750 women and 250 men. For the first time in Iran, there was a focus on male perspective as well to examine their role in the perpetration of FGM. A total of 4,000 interviews were carried out within the provinces. How widespread is the practice? FGM occurs in some villages of 3 western and 1 of the southern provinces of the country. Western provinces are populated by Sunni Shafis majority, and the southern province of Hormozgan and its islands have a significant Sunni Shafi community. Given that the different religious and ethnic groups are dispersed in these provinces, drawing an exact FGM-affected map with rates of FGM is problematic and unlikely. For example, practicing FGM in Iranian Kurdistan is patchy and will show up sharp variations from one region to another, even from one village to a nearby village. In some cases, elements of FGM tradition are very evident, but in others, even nearby villages, FGM has been in decline for the past 2 or 3 generations. Changing times and modern life, the death and non-replacement of babies, lack of willingness to accept FGM by the younger generation, education, and the impact of the media, as well as some level of support from the clerics, are all factors in the declining rate of FGM. During the decade of this study, we have observed that the rate of FGM is declining every year. For the reasons above, and because of the training and awareness-raising campaigns conducted by the study. The following graph demonstrates the reducing rate of FGM practicing during the last 6 years. There is the graph. It is called Decline in FGM during the period of 10 years. It consists of 2 main parts. one going from the year 2009 to 2014, and the other going from number 0 to 0.8. And there are 4 colors: blue, Hormozgan; red, West Azerbaijan; green, Kermanshah; purple, Kurdistan. The rate being the rate of FGM. 2009, red, 36%, almost nearing 0.4. Green, 31%, almost nearing 0.3. Purple, slightly below 0.3, at 29%. 2011, blue, 68%, slightly below 0.7. Red, 32%, slightly above 0.3. Green and purple both 28%, slightly below 0.3. 2012, blue 66%, between 0.6 and 0.7. Red 32%, slightly above 0.3. Green 25%, above 0.2. Purple 23%, slightly above 0.2. 2013, blue 62%, slightly above 0.6. Red 25%, between 0.2 and 0.3. Green and purple both 20% on 0.2. 2014, blue 60% on 0.6. Red 21%, slightly above 0.2. Green 18%, below 0.2. Purple 16%, between 0.1 and 0.2. As previously discussed, the prevalence of FGM is declining across the globe, including in the secret pockets in Iran. They are secret pockets because the world has very little knowledge about the presence of FGM in these provinces. Within Iran, a very limited number of people, all of whom belong to FGM-affected provinces, have knowledge about its practice and existence within the country. The graph shows a slow pace of change during the 6-year time frame, starting with the West Azerbaijan in 2009. During the year of 2010, Kurdistan and Kermanshah also showed responses to the wave of change and some decrease in the practice. Hormozgan province, where the prevalence of FGM is the highest in the country, still has a rate of more than 60% at the end of 2014, while for the same period, it was 21% in West Azerbaijan, 18% in Kermanshah, and 16% in Kurdistan. It is quite evident from the graph that the process of transformation has been initiated, and the affected regions are responding and adopting change. There is a graph. The graph is the percentage of circumcised women. It consists of 2 parts, one going from the percentage 0 to 60%, and the other 4 provinces: Kurdistan, Kermanshah, Western Azerbaijan, and Hormozgan. Saqez 3%, Divandare 12%, Marivan 42%, Kamiran 32%, Bane 4%, Ravansar 23%, Javanrud 18%, Pave 41%, Shahabad Firuzabad 2%, Sarpul Zahab 9%, Sardasht 23%, Piranshah 27%, Mahabad 21%, Bukan 18%, Shahindej 7%, Minab 32%, Bandar Khamir 44%, Bandar Lenge 51%, Esh and Hormuz and Kish Islands 60%, Persian 31%. The following section offers information on these 4 provinces consecutively. Profiles of the selected provinces. Hormozgan. The total population of Hormozgan is 1.5 million. Data shows that FGM is practiced on a massive number on baby girls in most Sunni Shafi villages of Hormozgan province. Some villages in the town of Minab, some Shia families also practice FGM. Villages and parts of small towns of Bandarpol, Bandar Kang, Lenge, Govbandi, Persian, and Khamir are also affected. FGM is also practiced on the small islands of Hormuz and Lorak. Qeshm, which is the largest island in the province, has a high rate of FGM among the most Sunni populations. Qeshm Island is also home to the large migrant groups of Shia from Minab, Bandar Abbas, and other mainland Iranian towns who do not practice FGM. Even on Kish Island, which is a tourist spot and one of Iranian's wealthiest places, girls undergo FGM. Research indicates that type 1 is common in this province. Ahmady reports in her research on the prevalence of FGM in Hormozgan province that, of the 400 cases she interviewed, 87.4% had type 1. Ahmady ETAL 2009. United Arab Emirates, UAE, with local people having families in the Gulf region and other nearby countries, it is likely that FGM occurs in the Gulf based on the interviews with locals from the south who are dual national and some entirely immigrated, and a short fieldwork trip to the UAE. We have confirmed that FGM does occur among Muslim families in the United Arab Emirates. Immigrant groups of Muslims from Iran, Oman, Yemen, Bahrain, and other countries practice FGM. Most neighborhoods have their own local bibis, and many families plan to circumcise their children while visiting their home countries. FGM is also practiced in some neighborhoods of Shehba, Nuf, and Garian of Sharjah, and Sharisha and Jolan in Ras Al Khamia and Satwa in Dubai. These neighborhoods have their own local practitioners. As of the data of the study, 2 bibis in Nuf, 1 bibi, and 2 family bibis in Jolan still practice FGM. The table below shows the prevalence of FGM in Hormozgan. In this page of the book, we have a picture of Hormozgan province, divided in different colors. Orange 41 to 62%, yellow 24 to 40%, green 8 to 23%, blue less than 8%, gray FGMC is not practiced in these areas, and white unpopulated or not researched areas. They can also be seen 2 pie charts in the picture, divided by different colors: red urban, darker blue rural men, lighter blue rural women from 0 to 14, sky blue rural women from 14 to 65, the color sea blue rural women upper than 65. Kurdistan. The total population of Kurdistan is 1.3 million. The practicing region of Kurdistan is Sunni Islam, a Shia minority of Kurds and some Turkish, leaving Gorve and Bijar. The main language is Kurdish, spoken in various dialects. Sorani, Ardalani is the main dialect, others are Kalhuri and Huarmani, though some Huarmas do believe that their language and ethnically is independent of Kurdish. Kurdistan is together with Kermanshah the most FGM-affected province in west of Iran. Some villages of Marivan region, and in particular Horman Takht, part of the upper Horman region, have high rates because they are situated close to Kermanshah province, which is also affected by FGM. Villages of Horman Takht, recently declared districts, have the highest rates of FGM in both Haram areas, which is divided between the 2 provinces of Kermanshah and Kurdistan. Other villages, such as Kemale, Belber, and a number of other towns in Salandash Kamiran and in Saqqez and Bana, however, are not affected by FGM. Local inhabitants in these places have confirmed that it has not been practiced for decades. In this page of the book, we have a picture of the Kurdistan province. The different sections and districts in the image has been colored by different colors: orange 41 to 62%, yellow 24 to 40%, green 8 to 23%, blue less than 8%, gray FGMC is not practiced in these areas, white unpopulated or not researched areas. There are also 2 pie charts in the image. Different colors are used in the pie charts: red urban, darker blue rural men, lighter blue rural women from 0 to 14, sky blue rural women from 14 to 65, ocean blue rural women upper than 65. Kermanshah. The total population of Kermanshah province is 1.8 million. The province is divided among groups belonging to Shia and Sunni Shafi branches of Islam, but there are, among others, a large minority of Ahl Haq, Lak, and a small Baha'i minority. The main language spoken in Kermanshah are Kurdish, Jaf, Fili, and Kalhuri, Huarmani, Laki, and Persian. FGM is mainly found in the areas called Hormozgan. Part of Hormozgan region is also located in neighboring Kurdistan province and in the region of Jaf tribe. Jaf is also named after dialect. Various villages belonging to Kameel, Ravansar, Javanrud, Pava, Notsha, Nosot, Mansur Aghayi are the most affected areas in Kermanshah province. The incidence of FGM among young women is however considerably lower, and the same applies for Kameel and Pava, though not in all villages. At least this is evidence in some of the above districts that people abandoned the practice decades ago. Children and juveniles are less likely to be cut, but among women older than 30 to 35, the rate increases. It becomes even higher among those older than 50 years of age. It is important nonetheless to recognize that the low rate among juveniles may also be caused by the custom of late mutilations. In the other places, late mutilations are marginal. The table and chart below depicts the prevalence of FGM in Kermanshah. There's a picture of Kermanshah province. Different districts in it are colored differently. Orange, 41 to 62%. Yellow, 24 to 40%. Green, 8 to 23%. Blue, less than 8%. Gray, FGMC is not practiced in these areas. White, unpopulated or not researched areas. There are also two pie charts in the image, colored differently. Red, urban. Dark blue, rural men. Lighter blue, rural, women from 0 to 40. Sky blue, rural, women from 40 to 65. Ocean blue, rural, women upper than 65. West Azerbaijan. The total population of West Azerbaijan is 3 million, and Kurdish population mainly live in the southern part of the province. However, a minority of Kermani-speaking Kurds also live by the border with Turkey from Urmiye to the town of Mako. Field research indicates that the ratio of the mutilation of elderly women is alarmingly high, and in the complete contrast, the rate of FGM among children is very low and declining every year. The study found that in some villages of the Mukrian regions, few of those above the age of 10 were mutilated. One of the reasons behind this diminishing rate in the south of West Azerbaijan province relates to the seasonal illegal crossing of Gypsy Roma groups, locally called Dom or Gerenchi, from Iraqi Kurdistan to Iranian Kurdistan. These groups make extra money by carrying out FGM in the area. The majority do not use safe methods, and there are serious risks of multiple types of disease and even disability. Years of monitoring the rate of FGM along the border of Iraq found that most of West Azerbaijan province and villages nearby the border with Iraq are dependent on the Iraq Kurdish gypsy groups to mutilate their daughters. The tightening of the border security by the Iranian border guards and the regional conflict with Iraq means that fewer of these groups manage to cross the border illegally, which has resulted in a decrease of the rate of FGM in this particular province. However, unlike West Azerbaijan province, Kurdistan and Kermanshah rely on their own bibis and self-trained old women to keep on the tradition of FGM alive. The rest of this study offers an overview of FGM from multiple perspectives. There's a picture, prevalence of FGM in West Azerbaijan. The districts are colored by different colors. Orange, 41 to 62%. Yellow, 24 to 40%. Green, 8 to 23%. Blue, less than 8%. Gray, FGMC is not practiced in these areas. White, unpopulated or not researched areas. There are also two pie charts in the image. Red, urban. Darker blue, rural men. Lighter blue, rural, women 0 to 40. Sky blue, rural, women 40 to 65. Ocean blue, rural, women upper than 65. Prevalence of FGM by age. The table below gives an overview of circumcised women by age in selected 4 provinces. For uniformity in result, an equal number of villages per province have been selected for the research. The results clearly demonstrate that there are regional differences in FGM prevalence. The first table shows that the percentage of circumcised women is high in some of the villages of Hormozgan province, where it can reach 60%. In some villages of Kesh, Hormoz, and Lorak Islands, prevalence is lowest. in some ethnic Persian villages, at 31%, northern parts of the province were FGM-free. Kermanshah province had the second highest prevalence of 42% in some villages of Marivan. However, in Kermanshah, the rates are a little lower, and in West Azerbaijan, the numbers are completely lower still. In the page 59, there is a picture of a little girl. Baby cut from age 2 months. Photo by S.H. Talinda. Analysis showed that the proportion of circumcised women in the 30 to 41 age bracket is higher among women and girls aged 50 to 29. In some villages of Hormozgan and Qeshm Island, the prevalence of FGM among women aged 29 to 49 reaches 61%. On the other hand, it appears to have been eliminated in Lakistan. In Kermanshah, where the study found no evidence of it, among women and girls aged 15 to 29. These findings therefore demonstrate an encouraging trend. FGM is decreasing in all 4 of the provinces. For instance, in Pirasheh, West Azerbaijan, the rate is less than 10% among the young generation. Similarly, in Javanrud, in the same province, there is a sharp decline from 41% in older women and 9% in younger women and girls. In some of the villages in Ravansar, it has again drastically decreased and reduced to 17% from 43%. There is a graph, the percentage of circumcised women by age 15 to 29 and 30 to 49. The graph consists of 2 parts. 1 provinces, Kurdistan, Kermanshah, Western Azerbaijan, and Hormozgan, red 34%, Marivan blue 22%, red 56%, Kameel, blue 60%, red 44%, Bane blue 2%, red 24%, Ravansar blue 17%, red 43%, Javanrud blue 9%, red 41%, Pave blue 28%, red 51%, Shahabad Firuzabad red 8%, Sarpul Zahab red 41%, Sardasht blue 5%, red 39%, Piranshah blue 8%, red 43%, Mahabad blue 7%, red 34%, Bukan blue 4%, red 40%, Shahindej blue 1%, red 29%, Minab blue 29%, red 48%, Bandar Khamir blue 37%, red 52%, Bandar Lenge blue 31%, red 43%, Qeshm and Hormozgan and Kish Islands, blue 45%, red 61%, Persian, blue 28%, red 42%. There is another graph, ratio of prevalences by women aged 50 to 29, 30 to 49. The graph consists of 2 parts. 4 provinces, Kurdistan, Kermanshah, Western Azerbaijan and Hormozgan, and the other going from number 0.0 to 1.0, Saqez 0.1%, Divandare 0.2%, Marivan 0.4%, Kameel 0.4%, Bane 0.1%, Ravansar 0.4%, Javanrud 0.2%, Pave 0.4%, Shahabad Firuzabad and Sarpul Zahab both 0.0%, Sardasht 0.1%, Piranshah and Mahabad both 0.2%, Bukan 0.1%, Shahindej slightly above 0.0%, Minab 0.6%, Bandar Khamir 0.7%, Bandar Lenge 0.7%, Qeshm and Hormozgan and Kish Islands 0.7%. Same for the Persian. Table 2.1 shows proportion of circumcised women by age. Generational trends. On the page 62, there's a picture. It is called Women with Less FGM in West Azerbaijan province. There is a number of women standing in the picture with a few children riding bicycles. The inverse relationship between age and FGM prevalence reveals that women who have been circumcised know the suffering this practice brings. Our feedback indicates that the new generation is aware and has their own thinking about how to lead their lives. Therefore, when a couple get married, they prefer their daughters to not suffer the way women of previous generations did. Data was compiled to measure the proportion of circumcised women by age through separate analytical questions in order to analyze the attitudinal change of mothers towards FGM over time. The findings of the survey revealed a big change in favor of ending FGM. There's a graph consists of two parts. On one part we can see 4 provinces: Kurdistan, Kermanshah, Western Azerbaijan, and Hormozgan. And on the other part, it goes from a percentage 0 to 70%. And there are 2 colors. The graph is the percentage of mothers with at least one circumcised daughter by age 15 to 29 and 30 to 49. There are 2 colors in the chart as well: blue 15 to 29, red 30 to 49, Sakez blue 1%, red 20%, Divandare blue 6%, red 34%, Marivan blue 16%, red 56%, Kamiran blue 11%, red 44%, Bane blue 2%, red 24%, Ravansar blue 7%, red 43%, Javanrud blue 5%, red 41%, Pave blue 21%, red 51%, Shahabad Firuzabad red 8%, Sarpol Zahab red 14%, Sardasht blue 3%, red 39%, Piranshah blue 5%, red 43%, Mahabad blue 4%, red 34%, Bukan blue 3%, red 40%, Shahindej blue 1%, red 29%, Minab blue 21%, red 48%, Bandar Khamir blue 29%, red 52%, Bandar Lenge blue 25%, red 43%, Qeshm and Hormuz and Kish Islands blue 35%, red 61%, Persian blue 20%, red 42%. Table 2.2 shows a ratio of women who have undergone FGM aged 15 to 49 with at least one daughter circumcised. The difference among the 15 to 29 and 30 to 49 age brackets is very important. It's very prominent in Kermanshah, where we see a decline exceeding 19% in Javanrud and Ravansar, and around 15% in Pave. As previously noted, we found no evidence of FGM in 15 to 29 age bracket in Lokestan area, and the same applies in Sarpol-e-Zaheb. In Hormozgan province, the data shows around a 50% decrease. In West Azerbaijan, a 90% difference between generations is recorded. Kurdistan also mirrors Hormozgan, showing a decrease in excess of 90% in some areas. It is pertinent to mention that the following data reflects those mothers who had the opportunity to circumcise their daughters and refused. There were a large number of women who mentioned that their other daughters are still too young, and that once they reach an appropriate age, they will undergo FGM. There's a graph, ratio of prevalences by women's age, 15 to 29, 30 to 49. The graph consists of 2 parts, one for provinces, Kurdistan, Kermanshah, Western Azerbaijan, and Hormozgan, and the other going from the number 0.0 to 1.0, Sakez 0.1, Ravansar 0.4, Javanrud 0.2, Pave 0.5, Shahabad Firuzabad, and Sarpol-e-Zahab both 0.0, Sardasht 0.1, Piranshah and Mahabad both 0.2, Bukan 0.1, Shahindej 0.0, Minab 0.6, Bandar Khamir, Bandar Lenge, Qeshm and Hormozgan and Kish Islands, and Persian all 0.7. The table 2.2, proportion of mothers surveyed with at least one circumcised daughter. Impact of education. Following the guidelines of DHS, MMICS, we collected data on the educational attainment of mothers to examine the relationship between this and FGM rates in their daughters. The table shows a significant impact regarding the educational levels of mothers in respect of whether a girl is subjected to FGM or not. It can be seen through the available findings show that a woman's educational attainment is one of the most important factors to influence whether the daughter will be genitally mutilated or not. The research and conversations with women revealed that highly educated women prefer not to victimize their daughters in this way. The lower the educational attainment, the more likely a mother is to follow the tradition blindly considering it a social norm or religious duty. But some educated mothers have nonetheless circumcised one of their daughters, although the rate is vanishingly small in 4 of the provinces, or no case has been found among educated women. The data collected from Kurdish regions suggests that the practice is in decline due to the increasingly high levels of education among women. The findings also show that highly educated women are less likely to support FGM generally, with fewer than 20% of those surveyed doing so. However, for such attitudes to make a practical difference, empowerment of women is also required. There is a graph. The percentage of mothers with at least one circumcised daughter by education, none and some. The graph consists of 2 parts, 4 provinces, Kurdistan, Kermanshah, Western Azerbaijan and Hormozgan, and the other part goes from the percentage 0 to 80%. And there are also 2 colors available, blue, some, red, none, Saqiz, blue 2%, red 46%, Divandare, blue 7%, red 64%, Marivan, blue 11%, red 63%, Kamiran, blue 9%, red 61%, Bane, blue 1%, red 54%, Ravansar, blue 4%, red 50%, Javanrud, blue 3%, red 49%, Pave, blue 10%, red 68%, Shahabad Firuzabad, red 54%, Sarpul Zahab, red 51%, Sardash, blue 3%, red 52%, Piranshah, blue 5%, red 58%, Mahabad, blue 1%, red 52%, Bukan, blue 3%, red 49%, Shahindej, blue 2%, red 23%, Minab, blue 9%, red 51%, Bandar Hamir, blue 11%, red 60%, Bandar Lenge, blue 7%, red 55%, Qeshm and Hormuz and Kish Islands, blue 13%, red 62%, Persian, blue 11%, red 56%. There is another graph. It is called Ratio of Prevalence in Daughters by Mothers by Education, some and none. The graph consists of 2 parts, 4 provinces, Kurdistan, Kermanshah, Western Azerbaijan and Hormozgan, and the other part goes from the numbers 0.0 to 1.0, Saqiz 0.0, Divandare 0.1, Marivan 0.2, Kamiran 0.1, Bane 0.0, Ravansar 0.1, Javanrud 0.1, Pave 0.1, Shahabad, Firuzabad and Sarpul Zahab both 0.0, Sardasht and Piranshah 0.1, Mahabad 0.0, Bukan 0.1, Shahindej 0.1, Minab 0.2, Bandar Khamir 0.2, Bandar Lengi 0.1, Qeshm and Hormozgan and Kish Island 0.2, Persian 0.2. Table 2.3 Proportion of educated mothers with at least one circumcised daughter. Impact of religion. Previous studies and the underlying research found that FGM is a ritual performed by majority of Sunnis in Iran. Though a myth, most of the world considers FGM an Islamic practice. However, even within Islam, there is a division of opinion on the practice. For Shias, who make up the majority in Iran, they see FGM as a tradition related to Sunni sect and do not consider this as a part of their religious obligations. Therefore, the prevalence of FGM is strikingly low in Shia population. The following findings from this research show a significant difference in FGM prevalence among Shia populations versus their Sunni counterparts. Shia in Kurdistan do not practice FGM, and in Western Azerbaijan, only 2% of Shias does. In Shahindej villages, in Lakistan and Sarpul Zahab villages, the rates are 4% and 5% respectively among Shia. In Hormozgan province, some evidence of FGM in Shia communities have been recorded in selected villages, which shows that, though in little number, FGM continues in some Shia communities in Hormozgan. Table 2.4 shows the proportion of circumcised women by sect. There is a graph. Percentage of circumcised women by religion, Sunni, Shia, and Yarsan. The graph consists of 2 parts. One consists of 4 provinces, Kurdistan, Kermanshah, West Azerbaijan, Hormozgan, and the other goes from the percentage 0 to 120%. It also has 3 colors: blue, Sunni; red, Shia; green, Yarsan; Saqez, blue, 100%; Divandare, blue, 100%; Marivan, blue, 100%; Kamiran and Bane, blue, 100%; Ravansar, blue, 86%; red, 2%; Javanrud and Pave, blue, 100%; Shahabad Firuzabad, red, 5%; Sarpul Zahab, blue, 69%; red, 16%; Sardasht, Piranshah, Mahabad, and Bukan, blue, 100%; Shahindej, blue, 66%; red, 2%; Minab, blue, 83%; red, 13%; Bandar Khamir, blue, 95%; red, 5%; Bandar Linge, blue, 94%; red, 6%; Qeshm and Hormuz and Kish Islands, blue, 96%; red, 4%; Persian, blue, 98%; red, 2%. Impact of household wealth. Poverty also plays a role in the prevalence of FGM in Iran. There is a link between those who practice FGM and their financial status. In order to measure the impact of financial status, DHS and MICS questionnaires were used to gather information on household assets and household ownership data, along with characteristics of dwellings such as available sanitation facilities and access to safe drinking water. Each asset factor is assigned a weight, and individuals are ranked according to the total score of the household in which they reside. Overall, FGM predominance appears to drop among women from families with a healthy background, but the relationship between household wealth and FGM is not always consistent. Overall, as table shows, FGM predominance appears to lowering among women of families with wealthy financial background. In our 4 provinces, the prevalence of FGM among richer women was under 15%. The findings revealed that in the selected 4 provinces, there is a homogeneity in terms of prevalence of FGM among wealthy households. Only in some Marivan villages in Kurdistan and Pave villages in Kermanshah were the rates higher, at 23% and 19% respectively, among wealthy households, while the rates shows less than 15% occurrence in richer women. Improved financial status allows for wealthy families access to a better life, education, exposure, and knowledge. Therefore, their perceptions about life and practices are different. However, some among the wealthy still adhere to FGM. There's a graph called the percentage of circumcised women by family wealth, poor or wealthy. The graph consists of 2 parts, one for provinces, Kurdistan, Kermanshah, Western Azerbaijan, and Hormozgan. The other goes from the percentage 0 to 70%. And there are 2 colors, blue, wealthy family; red, poor family. Saqez, blue, 1%; red, 28%. Divandare, blue, 6%; red, 61%. Marivan, blue, 23%; red, 51%. Kamiran, blue, 13%; red, 59%. Bane, blue, 1%; red, 32%. Ravansar, blue, 8%; red, 52%. Javanrud, blue, 7%; red, 51%. Pave, blue, 19%; red, 49%. Shahabad Firuzabad, blue, 3%; red, 54%. Sarpul Zahab, blue, 2%; red, 41%. Mahabad, blue, 2%; red, 49%. Bukan, blue, 4%; red, 39%. Shahindej, blue, 3%; red, 50%. Minab, blue, 6%; red, 45%. Bandar Khamir, blue, 8%; red, 44%. Bandar Lenge, blue, 5%; red, 51%. Qeshm and Hormuz and Kish Islands, blue, 6%; red, 39%. Persian, blue, 9%; red, 41%. There is a second graph called ratio of prevalence by family wealth, wealthy and poor. The graph consists of 2 parts. One going from the number 0.0 to 1.0, and the other 4 provinces, Kurdistan, Kermanshah, Western Azerbaijan, and Hormozgan. Saqez 0.0, Divandar 0.1, Marivan 0.5, Kamiran 0.2, Bane 0.0, Ravansar 0.2, Javanrud 0.1, Pave 0.4, Shahabad Firuzabad 0.1, Sarpul Zahab 0.0, Sardasht and Piranshahr 0.2, Mahabad 0.0, Bukhan 0.1, Shahindej 0.1, Minab 0.1, Bandar Khamir 0.2, Bandar Lengi 0.1, Qeshm and Hormuz and Kish Islands 0.2, Persian 0.2. Table 2.5, Proportion of circumcised women by financial status. Role of men and women's perceptions in FGM. On the page 70, there is a picture called Most Men Aware of FGM, photo by S.H. Talenda. It is important to understand how the perceptions of men and women about the FGM influence its survival, and also to find out who plays a prominent role in taking decisions to go ahead with FGM. The research used gender-focused questionnaires to determine the facts. The data shows that the most prominent figures in determining whether a girl is subjected to FGM are female, mostly the mother or grandmother, but sometimes another female relative. Men have some say in this, but not a dominant one. As for general support for FGM, the figures show that in Hormozgan, it reaches up to 44% among women in Qeshm, Hormuz, and Larak Islands, while the corresponding level among men is 33%. In Pava and Javanrud in Kermanshah, support is lower at 21% of women and less than 10% of men. The results show that, despite the patriarchal nature of society, men appear less concerned about FGM than women. However, it is the women who feel the silent pressure of the patriarchy and are compelled to continue with the ritual. There's a graph. It is called the percentage of circumcision support in family, men and women. It consists of two parts: provinces Kurdistan, Kermanshah, Western Azerbaijan, Hormozgan, and the other part goes from the percentage 0 to 50%. There are also two different colors: blue supporting men, red supporting women. Saqiz, blue and red 1%, Divan Darre, blue 5%, red 11%. Marivan blue 10%, red 26%. Hamiran blue 7%, red 19%. Bane blue 1%. Ravansar blue 8%, red 21%. Javanrud blue 5%, red 21%. Pave blue 21%, red 33%. Shahabad Firuzabad, Sarpul Zahab, both 0%. Sardasht blue 15%, red 12%. Piranshahr blue 10%, red 19%. Mahabad blue 6%, red 12%. Bukhan blue 6%, red 10%. Shahindej blue 1%, red 2%. Minab blue 19%, red 32%. Bandar Khamir blue 23%, red 39%. Bandar Lenge blue 11%, red 31%. Qeshm and Hormozgan Kish Islands blue 33%, red 44%. Persian blue 13%, red 32%. There is another graph. It is called Ratio of Circumcision Support by Parents' Gender, Men and Women. It consists of two different parts: 4 provinces, Kurdistan, Kermanshah, Western Azerbaijan and Hormozgan. And the other side goes from a number 0.0 to 1.0. Saqiz 1.0, Divan Darre 0.5, Marivan 0.4, Kamiran 0.4, Bane 0.0, Ravansar 0.4, Javanrud 0.2, Pave 0.6, Shahabad Firuzabad and Sarpur Zahab both 0.0, Sardasht 1.3, Piranshahr 0.5, Mahabad 0.5, Bukhan 0.6, Shahindej 0.5, Minab and Bandar Khamir 0.6, Bandar Lenge 0.5, Qeshm and Hormuz and Kish Islands 0.8, Persian 0.4. Table 2.6, Proportion of supporters of FGM among men and women. Influence of the type of FGM practitioner. Another contributing factor to the perpetuation of FGM is the vested interest of the circumcisers who are available within the community. The financial rewards they receive for the practice may be the only source of their livelihood. FGM in Iran is performed by 3 types of people: Roma groups, bibis, midwives, and family members, in practice older women. This scenario in every province is unique. In Hormozgan, FGM is mostly performed by traditional practitioners including bibis. However, in some areas or situations, family members may get involved. In West Azerbaijan, FGM is mainly done by Roma groups who illegally cross the Iraqi Kurdistan into West Azerbaijan province of Iranian Kurdistan, and who also run the risk of arrest by the Iranian border police due to not having a passport or visa. These groups make good income by carrying out FGM in the area. The majority do not use safe methods, which cause multiple types of diseases. In addition to the Roma groups, a mixed trend among family members and traditional practitioners was also found. In Kermanshah and Kurdistan villages, it is carried out by traditional practitioners, although in some villages, Roma groups and bibis are still active. They perform FGM with a razor, thorn, or knife. Without anesthesia, there is no concept of medicalized or hygienic circumcision. In the page 73, there is a photo. It is called Woman from Minab in Qeshm Island. Photo by S.H. Talanda. It is a picture of a woman. Almost every part of her body, aside from her eyes and a little bit of her cheeks, is covered. There is a graph. It is called the percentage of circumcision by the performer. It consists of 2 parts. 4 provinces, Kurdistan, Kermanshah, Western Azerbaijan, Hormozgan, and the other goes from the percentage 0 to 120. It also has 3 different colors: blue, traditional practitioner; red, family members; green, others, Roma women. Saqez, blue, 46%, red, 15%, green, 13%. Divandare, blue, 61%, red, 13%, green, 19%. Marivan, blue, 67%, red, 21%, green, 5%. Kamiran, blue, 66%, red, 33%. Bane, blue, 48%, red, 6%, green, 4%. Ravansar, blue, 67%, red, 30%. Javanrud, blue, 65%, red, 28%. Pave, blue, 87%, red, 12%, green, 8%. Shahabad Firuzabad, red, 1%, green, 45%. Sarpul Zahab, red, 5%, green, 13%. Sardasht, blue and red, 8%, green, 76%. Piranshah, blue, 9%, red, 3%, green, 82%. Mahabad, blue, 6%, red, less than 6%, green, 76%. Bukan, red, 7%, green, 88%. Shahindej, red, 1%, green, 98%. Minab, blue, 92%, red, 5%. Bandar Khamir, blue, 90%, red, 6%. Bandar Lenge, blue, 88%, red, 9%. Qeshm and Hormozgan Kish Islands, blue, 95%, red, 4%. Persian, blue, 91%, red, 4%. There's another graph, ratio of prevalence, circumcision performer, traditional practitioner, or others. The graph consists of 2 parts, one for provinces, Kurdistan, Kermanshah, Western Azerbaijan and Hormozgan, and the other going from the number 0.0 to 25.0. Saqez 1.6, Divandare 1.9, Marivan 2.6, Kamiran 2.0, Bane 4.8, Ravansar 2.2, Javanru 2.3, Pave 4.4, Shahabad Firuzabad and Sarpur Zahab both 0.0. Sardasht, Piranshah, Mahabad and Bukhan 0.1. Shahinde 0.0. Minab 18.4. Bandar Khamir 15.0. Bandar Lenge 9.8. Qeshm and Hormuz and Kish Islands 23.8. Persian 22.8. Table 2.7. Proportion of circumcisions by practitioners. Ratio of educated women in supporting FGM. Education plays a significant role in shaping people's opinion and influencing their point of view in order to gauge whether or not differences between levels of education can affect the level of support for FGM. A survey was carried out in the 4 selected provinces in Iran. The findings show that highly educated women are less likely to support the continuity of the practice. The ratio of supporting FGM among educated women is relatively high in Hormozgan province and falls between 11 to 19%. In West Azerbaijan, the level of support for the practice among educated women is very low. Similarly, In Kermanshah province, FGM encounters opposition by non-educated women of 6%, 7%, and 18% in Javanrud, Ravansa, and Pava villages, respectively. Kurdistan's situation is similar. Some educated women still support the continuation of the practice, while the rest are against the practice. It is clear that the education can be a factor to influence behaviors, attitude, and opinions. However, there are other prerequisites of empowerment which together can also make a difference. There's a graph. It is called the percentage of women that support circumcision by education, none, and some. The graph consists of two parts, one for provinces, Kurdistan, Kermanshah, Western Azerbaijan, Hormozgan, and the other goes from the percentage 0 to 50. There are also two colors, blue, some, red, none. Saqiz, red, 1%. Divandare, blue, 2%. Red, 29%. Marivan, blue, 11%. Red, 39%. Camiran, blue, 9%. Red, 34%. Bane, red, 1%. Ravansar, blue, 7%. Red, 29%. Javanrud, blue, 6%. Red, 27%. Pave, blue, 18%. Red, 41%. Shahabad Firuzabad, 0. Sarpul Zahab, red, 1%. Sardasht, 2%. Red, 21%. Piranshah, blue, 1%. Red, 32%. Mahabad, red, 31%. Bukan, blue, 1%. Red, 29%. Shahindej, red, 23%. Minab, blue, 11%. Red, 39%. Bandar Khamir, blue, 13%. Red, 43%. Bandar Lenge, blue, 15%. Red, 40%. Kashmir, Hormuz, and Kish Islands, blue, 19%. Red, 47%. Persian, blue, 11%. Red, 33%. There is another graph. It is called the ratio of prevalence, women that support circumcision by education, some and none. It consists of two parts, 4 provinces, Kurdistan, Kermanshah, Western Azerbaijan, Hormozgan, and the other part goes from the number 0.0 to 1.0, Saqiz 0.0, Divandare 0.1, Marivan 0.3, Camiran 0.3, Bane 0.0, Ravansar, Javanrud both 0.2, Pave 0.4, Shahabad, Firuzabad, and Sarpul Zahab both 0.0, Sardash 0.1, Piranshah, Mahabad, Bukan, and Shahindej 0.0, Minab 0.3, Bandar Khamir 0.3, Bandar Lenge and Kashmir, Hormuz, and Kish Islands 0.4, Persian 0.3. Table 2.8, Ratio of educated women supporting FGM. Summary of findings. Most parts of this research had come to a stop by the end of 2014. Despite this apparent setback, much has been achieved over a decade of studying the subject of FGM in Iran. It included traveling thousands of kilometers, visiting more than 200 villages, and interviewing over 4,000 women and some men from various areas and social classes in order to compile comprehensive data about the FGM practice in Iran. Although this research has not yet been fully evaluated, preliminary findings demonstrate that FGM in some selected villages is widespread among women and girls, around 60% in some villages of Kashmir Island, for example, especially in the villages of 4 provinces in the northeast, west, and south of Iran. Within these provinces, however, FGM was not practiced in the northern parts of Western Azerbaijan, where people of Kurmanji Kurdish speakers, nor in the southern parts of Kermanshah and northern parts of Hormozgan. On the page 77, there is a picture. It is called Women with No FGM in Boshir. The picture is taken by Kameel Ahmady. There are 6 women available in the picture. The real rate of FGM today is something that must be gleaned from the number of newborns and young children who are being mutilated. It is a good sign that the percentage of FGM among women and girls aged 15 to 29 is lower by 30% in comparison with women aged 30 to 49, and it appears lower than 8% among children below the age of 10. These points lead us to the conclusion that the rate of FGM has fallen steadily in the last few decades. From interviews with people of both sexes aged 15 to 49 indicate that 38% still support the practice of FGM for reasons of religion, tradition, and culture. Such rates clearly show that immediate intervention and awareness programs, together with public engagement projects, are urgently required in order to change attitudes. Although it is clear that support among younger generations is lower and FGM rates have declined in each of the past 10 years, it is difficult to decide whether FGM as a whole is declining fast, although over the past 10 years, seen a lower rate with each successive year. The few important factors in this decline are what we might term modernity, better access to education, lack of interest in religion among youth, greater access to various mediums of media, partly through the impact of technology, and the impact of migration from villages to towns. A large number of villagers have a secondary home in a nearby town. What is more, elderly babies may not be able to travel around to perform circumcision and are not being replaced with a younger generation of practitioners. The research undertaken from the study employed mixed research techniques. Interviews used both open-ended and closed questions, and the data was prepared with a mix of qualitative and quantitative methods. This was for the reason that the raw data cannot give an accurate picture of the reality on the ground situation. Likewise, when trying to evaluate the impact of even a simple development intervention, we found that complex factors were involved, which cannot be captured by a single evaluation procedure. Mixed methods through the combination of apparent and hidden realities given by the outcomes of qualitative methods and statistical information provided by the quantitative methodology produce a comprehensive analysis of the problem. Bamberger, 2000. An example is Table 2.6, showing the highest percentage of women who support FGM and who play a predominant role in FGM as compared to their male counterparts. According to these women's responses to the underlying research questionnaire, a woman's virginity is of vital importance to secure her future and to gain her marital status. If a woman cannot protect her virginity, it means she has ruined the honor of her family. This ultimately overburdens her to preserve the family retribution by any means, and, or in order to meet that objective, women continue the ritual of circumcision in the family. The pilot interventions. After collection of the initial data in 2010, pilot projects were launched. These pilot interventions aim to examine different and locally modified methods to reduce the prevalence of FGM in parts of Iran, the Persian and Arab regions in the southern part, the Kurdish region in the west of Iran. The idea was based on the assumption that certain defined low-profile interventions can bring about a grassroots abandonment of the practice by the community itself, as opposed to forced elimination by the government or outside of the community. The study went forward with an approach grounded in Iranian traditions and culture, adopted a holistic, culturally sensitive, participatory approach based on a firm foundation of human rights project interventions. Project interventions were divided into two categories. One category focused on the community, and the second one was based on advocacy and networking. Focusing on community means the interventions were specifically designed to find a way to prevent the practice of FGM. For this purpose, it was imperative to adopt an indirect approach because FGM was a ritual engraved into souls of the local people, and any direct attempts to erase the practice could prove lethal for the entire research project. The second category enabled us to work with the local people. Below is a brief overview of the pilot project interventions. In the page 79, there is a picture. It is called Hormon Religious Site. The picture is taken by Kameel Ahmady. There is a tree with some stuff hanging from it, and people gathering around it. Closer to the tree are standing a young kid boy and a lady. As this was a pilot project, the resources were limited. Within the resource limitation of the study, services of fully trained local professionals, one local worker, one psychologist and one nurse were engaged. It was imperative that they were locals from the same community group as those interviewed in order to attract the best level of cooperation and trust by the local both men and women. The researchers have been trained to enable them to undertake maximum fieldwork on their own through social and local engagement in order to obtain better coverage. The members started to map their own areas and worked independently, using social events as a potential platform. For example, weddings, Quran lessons, and funerals. The basic purpose of this strategy was to gain better and greater access to public. The pilot intervention supported the findings from this research. FGM is widespread in some areas, and in some parts it's declining. Since then, the focus of work gradually shifted from providing medical care to FGM awareness training, including lobbying and networking with stakeholders and religious and the community leaders.